Biofeedback is the process of measuring or sensing a physiological response and feeding it back to the person, and then that person using it to stabilize balance of physiology so that we can understand our tension, our stress. Now we're sensing the body here. We're going to be using the body and we're going to be sensing it with our system of quantum biofeedback. Quantum biofeedback, we're not developing an awareness for you to change. The machine is trying to sculpt out and improve your body electric. So it's up to you to sense and measure the different responses. A different type of biofeedback, the normal type of biofeedback. A type of biofeedback built on your own inner awareness. And building your own inner awareness to come to grips and to change, to take responsibility for your health. That's what true biofeedback is. You can control your physiological response. You can lower your blood pressure, lower your stress, lower your tension. We're going to be working to lower the stress and tension, turning on the parasympathetic system. Remember the acronym AWARE, A-W-A-R-E. Remember this simple acronym: air, water, awareness, recognition, and effort. Biofeedback, you're going to be sensing your body and sensing the tension to try to reduce it. Everything about this procedure now is about relaxing. We're going to need to get air. Feel our need for air. Know when we need more. Feel our need for water. Learn when we're really thirsty. Become awareness of the whole body, the aches, the pains, the numb areas, all the different things. Become more aware of what the body's telling us. And then recognize the messages from the body. Learn about recognition.
The body always tells you what to do, what to eat, what to feel.
And then learn the effort and the will and the discipline to change.
And turn your life around.
So that you can get this. Now we're going to start off with air. And we're going to tell you how to reduce the tension and treat your body naturally with biofeedback. Here's a biofeedback lesson to get the most out of life. The most essential nutrient of life is air. And most people only get 25% of the available oxygen in their lungs. Most people just do chest breathing. We now need to teach them to do diaphragm breathing or belly breathing, to utilize the complete lung, to be able to utilize the diaphragm and the ribs. And if you can expand and focus and get the complete breath through the diaphragm and into the chest, into the sinuses, then all of life's processes will work better and health will be increased because you will charge up oxygen.
Belly breathing is deeper part of the lungs. The chest is the upper part of the lungs. That is deep breathing. And even within the head.
In the head, we have sinuses that can receive oxygen. These sinuses are actually cooling towers for the pineal gland. And with the pineal gaze, as you're breathing, you can intensify, because the sinuses are cooling towers for the pituitary, cooling towers for the hypothalamus, cooling towers for the limbic system of our emotions. So it's very important as we get all of the oxygen, we're starting to activate all of our system. The limbic system, stabilizing emotions, and activating the pineal gland, our third eye, which will increase melatonin and DMT through the body.
Belly, chest, head. That's the way it goes, like this. Letting go.
Now let's add some more parasympathetic juice to this. Inhale, stimulating the vagus nerve, belly goes out. Joyful smile, stimulating the facial nerve. Serene eyes, stimulating the oculomotor. And pleasurable exhale, stimulating the glossopharyngeal.
We can add alternate nostril breathing, but moving the spinal fluid and the brain fluid, circulating the cerebral spinal fluid is very important. You inhale, expand your chest, expand your stomach, belly breathe, get your neck, it goes back like this, your chin goes back, and when you exhale, curve down so that you get cerebral spinal from the cervical all the way down into the spinal, the sacral. Inhale and exhale and flux, and you will be moving the cerebral spinal fluid. It will be cleaning out the system, bringing nutrients, oxygen, and taking away impurities. To cycle the cerebral spinal fluid as you breathe with a little extra kick to it. So now we're activating oxygen and cleaning out the system throughout the entire body. The belly breathing will stimulate the vagus nerve. We're now stimulating the entire hormones to stabilize the entire body. The autonomic nervous system will become more balanced. All of the health processes, all of our biological processes will be improved. Now, we're going to be doing this for 10 to 30 breaths 2 or 3 times a day. Relax, sit down, fill the belly, the chest, the head, the sinuses. Use the pineal gaze, stare at the center of the breath. Pull the head down to cycle the cerebral spinal fluid. Somewhere between 10 to 30 breaths. Exhale, and then exhale and hold until you get a gas reflex. Then the breathing, this carbon dioxide will be balanced. Your adrenals will be balanced. You become more outlined, relaxed, creative, and healthy. You can also use alternate nostril breathing. Learn how to do this so that can help to stabilize the brain to deal with trauma, stress, and other factors, as well as doing cross-crawl technique to help stabilize both sides of the brain. Now you're going to be getting full oxygenation. You're going to be getting oxygen throughout the whole system, moving the cerebral spinal fluid, using cross-crawl technique for both sides of the brain. And you now are developing a quantum biofeedback system to be able to maximize health, get feedback into your body. Now you learned about breathing and air. Now let's talk about water and thirst.
Every time that you sweat, you digest your food, or even breathe, you're really losing water. So you have to replace it. But many studies show that kids aren't drinking enough water. So what's up with that? Because you have to have it.
I'm Dr. John Torres, an emergency physician and the NBC medical correspondent. Hydration means that you're getting fluid into your body. The majority of what we have inside of us is water, and we need that water in order to survive. You have to get that from external sources, meaning you have to drink it.
Yes, water is the essential nutrient, and it does so many things for us. So many things within our body that depend on water.
Once you drink it, it goes into your intestine, goes into your guts, and from there it goes into the body, into all the cells. Once it gets done with the cells, it goes through our bloodstream and gets filtered out through our kidneys.
So exactly how much do you need? Just remember the number 8.
9 years old and above need 8 8-ounce glasses of water a day. This is an 8-ounce glass. It's a very normal amount of water.
It isn't just water we need minerals, and sometimes RO water takes out the minerals. Distilled water takes out the minerals. We need to get minerals in the water to replace the electrolytes and to deal with all the other different problems. We need minerals in our water for us to properly be healthy.
Every cell in your body uses water to function. If it can't get that water, that cell is going to start shrinking. It's not going to work as well. And this includes your brain cells. So what's going to happen is you're going to start getting confused. You're going to start getting a headache. Your muscles aren't going to work as well. You might even start cramping up a little bit. As you get more dehydrated, that's going to get worse and worse. If you get too dehydrated, you can get in a world of hurt.
To really get minerals into our water, we might use lemon, cucumber, other natural agents to help bring that to life, strawberry, other things to help get the minerals into our water that we need for life.
The way to know if you're dehydrated is to wait until you're thirsty, because by then you're already dehydrated. One of the things you can do is you're walking around and just pinch the skin on the back of your hand. If when you pinch it and let go, it goes flat, then you're fine. That means you're perfectly hydrated.
All right, well, It looks like I'm doing pretty well. How about you? There's something else that you can do, and it's actually the most reliable. Just listen to this.
Look at your pee next time you go to the bathroom. If it's really dark, I'll give you some examples here, that means you're dehydrated. So the pee gets darker because it's more concentrated, and that means that you need more fluids. If it's kind of middle of the road, that means you're doing okay. You might want to push a little bit more fluids, drink another glass or two to make sure that you get it down to the point where it's this light yellow, and that's what you want because that means you're perfectly hydrated, you're right exactly where you need to be.
Chamomile tea, very rich in lithium, or the richest food source of lithium. And it has other minerals in it as well. And alfalfa is nature's poor man's vitamin, full of minerals. So now we've learned about some of the ideas of getting water into our bodies. Now the next step, awareness. We want to become aware. We want to be able to recognize our awareness. We want you to build your own natural biofeedback system. Listen to what the body's telling you. Now the quantum machine is doing its work and it's measuring your body electric and fixing it. It's doing a quantum biofeedback. In your mind now, listen to the messages of the body, the stresses, the tension, the pain, the aches, the itching. Get this from the emotions of the limbic system. All of these messages are going to be coming to you. Learn to recognize them. Awareness, recognition, and then effort.
As soon as your body, mind, and spirit are connected, that can bring you to a higher awareness level, and you can hear your body's messages and all the organic signs, which can lead you to healthier habits, healthier eating, and then you help your gut to be able to digest everything and proceed the food, the nutrition, and all the minerals you take in.
Listen to the body, listen to your system, listen to your emotions, listen to these things, and get a biofeedback system. Things you don't like, you can reduce.
Listen to your own feedback.
And recognize that we must have fiber in order to feed the gut bacteria to make the proper hormones. We need plant fiber, whole plant foods, very, very important.
That is a motor to keep your brain and all the neurotransmitters working and giving you a good, healthy mindset, awareness, focus.
Whole plant foods, a must. Be sure to get this, to get your gut-affecting hormones to stabilize thoughts, emotions.
Mental stability.
Also, you get too many shoulds, creates shoulder problems.
Back problems, spine problems.
Try to reduce the amount of shoulds. Try to take them lightly. Deal with them a little bit more creative.
Try to make an aware to-do list, what to eat, what to do.
Stress and tension that catch in the spine. Be able to feel the spine problems.
Do stretching and yoga every day.
Yoga, flexibility to help your body.
Take enough time for yourself, to your own health, to your physical, mental, and emotional health.
And the senses will affect your system and your emotions.
And your nerve system.
Sometimes you see things you don't like, you hear things you don't like. These things happen. We have to become aware.
Try to accept the current situation and don't try to fight it.
So that when we see things we don't like, we have to be able to process and deal with them with the whole brain.
If our mindset and nerve system is stable, we can deal with all kinds of things.
Sometimes people say things we don't like. We have to be able to process those too. So we hear things. Sometimes we don't like them. We have to process them and deal with it appropriately.
Sometimes we hear music what we don't like.
Sometimes there are smells that we don't like. Our bodies have to be able to process it, good and bad, and get a feedback system. So we recognize to let go of all the stress and tension.
And then our reactions and our ability to handle things is going to become a lot more robust and healthy.
And sometimes we get lymphatic congestion because of inactivity, toxicity, poor food,
emotional clogs.
Sensing. We need to have our biofeedback, sensing when the body needs more exercise.
Or just a simple lymphatic drainage or cleansing.
So we could get that biofeedback system. And recognizing that compassion, contemplation, meditation, very important.
Emotional, physical, physical and mental package are the whole which create our health, our well-being, our feelings, reactions, and our existence and life force.
On this little video, what you hear is music all designed to help relax the body, stimulating the parasympathetic system, which does so many things. And bottom line, this increases immunity. When you relax and stimulate the parasympathetic system, you increase immunity. Now here's the pineal gaze. Look upward to the middle, up into the system. And as you look, you'll be stimulating your pineal.
And your third eye, and also your spiritual vision.
To help it, you can also press on the yin-tang acupoint right there. And this will stimulate the pineal to help stabilize the body. The pineal gaze needs to be done at least a couple of minutes every day. That's all it takes. Help to stimulate the pineal to work. And did you know
slow or deep stretches activate the parasympathetic nervous system?
Almost any type of yoga helps the parasympathetic system to be stimulated, and that helps you to relax. Here's some other tips.
Breathe in slowly, counting to 5. So it's a breathe in through the nose, slowly counting to 5. Inhale, and when you get to 5, you're holding your breath for 2 seconds. Just count to 2 in your own mind, hold your breath.
This simple little breath exercise, known as the 5-2-8, will stimulate the parasympathetic system, and it's better than any relaxation drug you can imagine.
And then the really important part is the exhale. So you're breathing out slowly, back out through your nose and slowly counting out to 8. You really want to kind of get that last breath to tail out into the 8th. Do that 3 times.
Use belly breathing. Inhale for 5 seconds, hold 2 seconds, and then exhale for 8 seconds or more. Another tip, a little bit of cold water on the face will stimulate the parasympathetic system. Slight pressure on the eyes, just very slight, don't push too hard. A little slight pressure on the eyes, or cold water on the eyes, and it helps to stimulate the parasympathetic system. And here's a couple of more tips.
Your tongue towards the back, you can feel where it goes from being hard to being soft. That's called your soft palate, way in the back of the top of your mouth. Now, the soft palate is located right beneath your brain, and it's actually the top end of your vagus nerve sits right above your soft palate.
For all of you who have our machine, Skio, Eductor, QXCDS, QXCD, you can just easily go to the NLP panel, to the new GSR TDCS option, and use scientific frequency stimulation. You can balance the vagus nerve.
Raising the soft palate. Now, singers have been trained to do this as they sing, to open up the size of their mouth. And one of the ways you can teach yourself to do that is by making the R sound. So R, you can feel that soft palate lifting up. R.
All the R sounds, ra, ma, ro, throw, I was taught, that worked on the throat area. That would help to open up for thyroid, the throat chakra, and stimulate the vagus nerve.
Also, trigger that vagus nerve is by yawning on purpose. So go ahead and make a big fake yawn. It might even turn into a real yawn. If you can't do that, watch some videos of people yawning and it'll make you yawn.
So here's a yawn, a really powerful yawn. When you see somebody yawn, it makes you want to yawn. And when you yawn, very deep, nice long yawn, it's your body telling you that you want oxygen, movement, but it's also stimulating the vagus nerve.
And I also heard that sometimes you're letting bad energies out of your body when you yawn.
That can be.
Of course.
And we're starting to get a real activation. So a good yawn can help to stabilize and relax you.
And activate your system or release some emotion.
And as you're doing this, you're going to find out that you're going to be working with the TMJ, temporal mandibular joint of the jaw. And this is very important for how it works on the parasympathetic system.
Every time we open our mouth or close our mouth or go side to side, this joint is moving and articulating in that particular disc. And if this joint is out of its normal position, this can cause pain, dysfunction, inflammation.
How to mobilize the temporomandibular joint on a patient. Very often we'll have patients go home. We'll teach them how to do this on their own. Their hands need to be clean, or I send them home with a glove. Basically, I ask them to use their thumb on the bottom of their bottom jaw molars.
Masseter and the temporalis. The masseter muscles are in the jaw area. Again, these are the ones that allow your mouth to close and squeeze. As you take your fingers up here, open your mouth and close. You feel that movement. Those are the temporalis muscles.
And they're basically going to just, again, move their jaw down in this direction. So I'm going to come in and demonstrate how it's done, and obviously they're not going to be able to talk.
But as we work the masseter muscles, you're going to use this part of your hand. You're just going to go to the bottom part of the jaw and push in and up. Good. Not real hard, just firmly. Good. Should feel real good, real good. 3 of them. Come up in the temporal region. You're going to push up on the temporalis muscles.
I can also add in, with the long distraction, a little bit of translation. What we do is we try to get the jaw to be nice and relaxed, and from there find the position of comfort, and then basically move the wrist out in this direction.
The same thing, but this time we're going to open our mouth slowly as we do it, like this. Close it, do it again. Good, one more time. Okay.
Yes, the TMJ is very, very powerful, and we need to learn about this and also be chewing our foods. Very, very powerful. But recognize that many people bring their head too far to the front. They bring their head to the food. This puts pressure on the neck, the TMJ. You have to hold your head steady. Posture is very, very important. Make sure you maintain very good posture. Now here's some acupuncture points. Very good for helping your body to relax, stimulating the vagus nerve and the crick of the elbow up in the thumb. And then here we have spirit gate down here at the bottom of the wrist. And over here on the back of the head, points on the gallbladder meridian. Very, very helpful to help stimulate relaxation and calm the body down. And Rita, what else is important?
It's very important to exercise, to do daily a little bit of walking, stretching. You can also do aerobics, cardiovascular exercises, yoga, Pilates, high intensity.
You need to work exercise
into your life, into your everyday.
Our bodies are designed to chop wood and carry water, and exercise is a nutrient that we need.
And there are all kinds of exercises at all areas you can find, no matter how old you are and no matter of your circumstances. You can actually make space for it. You can make it happen. It is only a mind decision, and it is up to you.
So here we have given you a whole bunch of tips, and now for the next couple of minutes, the system is going to interface, giving you relaxation impulses. If you're on the machine will be helping your quantum system to relax, to help reduce all the problems of high blood pressure, high tension, pain, stress, aches.
This will affect your emotions, your mind, body, spirit. Just let the music in and let it relax you.
And learn to do biofeedback in your body. Listen to your body.